To our Facts Not Fear coverage of COVID-19, perhaps a major sign of a return back to normalcy.
Or at least what health experts call an endemic. Starting today, the state will not be sharing those daily COVID-19 cases you may have been used to hearing. Schools are no longer required to report positive COVID-19 tests. Statewide cases, hospitalizations, ICU admissions, and vaccination data will be reported once a week. Dr. Bruce Vanderhoff is the head of the Ohio Department of Health.
Ohio has been one of only a handful of states still reporting COVID-19 data daily. Cases, hospitalizations, ICU admissions, vaccinations, which are all currently reported daily, along with deaths, which are reported twice weekly, will be reported each Thursday.
10 TV's Krista Frost is live now with more perspective from our 10 TV team of experts on this change. Krista.
Yeah, that's right. So a question that some people may have is, what exactly does this mean in relation to me and the way I live my everyday life? And that's actually the question that we asked Ohio Health's infectious disease expert, Dr. Joseph Gastaldo. And he says that we're entering an endemic phase. I know that's a word that we've heard a lot. So what exactly does it mean? I actually did some research to figure that out. Well, what it means is that the disease is present, but more at a baseline level. So it's not at zero, but cases, they're not surging at unexpected rates like we've seen really over the last 2 years. Now, this is allowing Ohio to make some of those changes and how we report that data. Now, Gastaldo also says that daily test count, it's less reliable now because of at-home testing, which is not reported to the Ohio Department of Health. So with those lower positivity rates, we're changing how we report that data. And masks, they're now optional in most areas. We asked him, what should people do now?
Everybody should have a plan in place. Do you have your home test? If you don't have your home test, how are you going to get a PCR test done and get the results back in real time? If you're immunocompromised or you have an at-risk condition, you get COVID-19, what's that plan like for you to get outpatient treatments?
And so another thing that Gastaldo mentions that it's important to keep in mind, this is where we are right now when it comes to change and how we report that COVID data. But that doesn't mean that maybe a month or more from now, we can't see a spike in COVID cases. That may make a change in how we report that data, among a few other things in relation to COVID. But for now, reporting live in Columbus, Krista Frost, 10 TV News.